Hi, I'm Dr. Russ Atkin. Thank you for taking a moment to watch this video made by the obstetric providers at BID Plymouth. The goal of this video is to provide you with information about breastfeeding and the support you can expect to receive from our staff during your pregnancy, hospital stay, and even after you've gone home. We are not here to pressure you in any way about the choices you make on how to feed your baby. We have found that many of our patients have the same questions and concerns about breastfeeding, and we hope that this video will help you gain a better understanding of what to expect in the hospital and help you make informed choices about feeding your baby. Thank you.
Hi, I'm Corey Sines. Breast milk is the perfect food for your baby. It is easy for them to digest, so they often have less GI issues. Breastfeeding protects babies against certain illnesses. Specifically, it decreases the rate of ear infections, respiratory infections, and gastrointestinal infections. Breastfeeding also decreases the rate of long-term chronic illnesses such as asthma, diabetes, obesity, and allergies. In addition, breastfeeding reduces the rate of sudden infant death syndrome, or SIDS, as well as many types of cancers.
Hi, I'm Dr. Veronica Del Richo. I do want to let you know that breastfeeding also has benefits for mom. It helps to reduce the rates of breast and ovarian cancer. It also helps to reduce the rate of adult diabetes, also known as type 2 diabetes. Furthermore, it could also help mom return to her pre-pregnancy weight and shape much faster.
Hi, I'm Gwen Olson. I'm one of the midwives here. Research has shown that one of the best things you can do for your newborn is to hold them skin to skin. This means that your baby is naked besides their diaper and held to your naked chest. There should be no clothing or blankets between you and your newborn, but you should have a blanket covering your baby's back to help keep him or her warm.
Hi, I'm Lizzie Keatway. I'm one of the nurse midwives. Skin to skin has a lot of benefits. It helps babies regulate their heart rate, their breathing, and their temperature. Breastfeeding has a lot of success when babies are able to be skin to skin in those feedings in the early days, because babies use their sense of smell and their sense of touch to help them breastfeed. And most moms and dads have said that it's a great way to bond with their baby and to help calm their baby.
Hi, I'm Dr. Erica Mello. I'm here to talk to you about rooming in. Rooming in is beneficial for moms and babies. Babies naturally want to be close to their mothers. It helps them with their warmth and nutrition. Babies actually cry less when they're close with their moms. We also find that babies that room in have less cortisol levels, so it decreases their stress, which is helpful for their feeding and temperature control. And in fact, if babies are out of the room for greater than an hour, we find that they can demonstrate more difficulty with latching because they need to calm down first. We also find that rooming in is beneficial to moms. It builds their confidence. It helps them identify their baby's feeding cues or when they're hungry. And we also find that moms that room in with their babies have better sleep, which we know that all new moms need their sleep.
Hi, my name is Kate Mahar. I'm one of the nurse midwives, and I'm going to talk a little bit about feeding cues for newborn babies. So babies will start letting parents know that they're hungry even when their eyes are closed. You might notice them sticking their tongue out or smacking their lips. The next step, their eyes will be open, and you might notice them trying to put their fists into their mouth. It's important that you get baby latched on prior to them getting super fussy, or it can be much harder to get a good latch and have a successful feed.
Hi, I'm Shelley Downing, one of the nurse midwives. We encourage you to offer your baby the breast often, beginning right away in the hospital. Research shows that babies are successful nursers when they feed at least 8 times in 24 hours. The first milk, called colostrum, is packed full of nutrients and antibodies that are uniquely designed specifically for your newborn. Colostrum digests rapidly, so you may need to feed the baby often, especially in the first few days. These frequent feedings are called cluster feeding and are common to see beginning on the second night of life. There are no time limits set on the frequency or length of feedings. The more the baby nurses, the more milk your body will produce for him or her.
Hi, my name's Hope Bolden Courier. I'm one of the nurse midwives here. Position and latch are really key elements for breastfeeding success. Many new moms are amazed at how challenging this can be. If the baby's not latched correctly, he or she won't get the proper nutrition, and this could decrease mom's milk supply as well as cause sore nipples. Practice and patience are key elements for success. The baby needs to have his or her mouth open very wide, taking in as much of mom's breast as possible, This helps stimulate adequate milk production and decreases mom's discomfort.
Hi, my name is Dr. Susan James. This is a graphic of some of the most commonly used feeding positions. Notice that the baby's hip, ear, and shoulder are all in alignment in each of these positions. During your stay here, our OB staff, nurses, and lactation consultants will educate you on the proper position and latch. We will even come to assess you during some of the feedings to make sure that the baby is latched, positioned, and showing signs of swallowing. If you are having problems when you leave, we can even set up outpatient lactation services after your discharge.
Hi, my name is Agnes Densmore. I'm one of the nurse midwives with Beth Deaconess. You might think that it's a great idea to give your baby a bottle in those early days that are so difficult after giving birth. Giving a baby a bottle with a nipple on it has been well established to cause confusion in the newborn who's trying to learn to breastfeed. The muscles that a baby uses to breastfeed are very different than the muscles that the baby uses for a bottle nipple. The formula that flows out of the bottle flows very fast. These two things together, the different muscles and the different rate of flow, can cause what is called nipple confusion, and it might even make your baby not want to breastfeed as much. We recommend decreasing or not using at all pacifier and a bottle nipple in the hospital in those first 2 weeks that are so important in establishing breastfeeding. Now, occasionally the pediatric staff may feel that it's important for your baby to have some supplementation. We know that the breast milk is the best and more superior form of feeding, but in very rare circumstances that becomes necessary. If that's the case with your baby, then the nursing staff will help you use a feeding syringe rather than a bottle nipple, to give your baby that extra sustenance so that you can still have a successful establishment of your breastfeeding.
Hi, my name is Dr. Kristen Gold. I'm one of the OBGYNs here at BID Plymouth. Thank you for taking the time to view our video today. If you'd like to view the video again, please visit our website for a link. If this video has brought up any questions or concerns, please talk to your provider about them at your next visit. If you are not planning on feeding your baby breast milk, please discuss it with your provider so that we can discuss safe formula preparation.